I see the future of Vera as changing healthcare. I mean, two of the biggest problems with healthcare these days are number one, how healthcare is delivered and the cost of healthcare.
We're on-site primary healthcare clinics. Your employees can walk out of your building, or in some cases just walk downstairs and go in and see a doctor. And they can get their primary healthcare needs met, they can get their urgent care needs met. It's very easy for people to grab hold of that, because if I walk into work and I'm not feeling well, I can just go down to the clinic.
This is a group of providers, a group of caregivers that knows our organization. They know what makes it tick and what makes it run. So when there's something going on at Children's, like we're having high census and there's increased stress, they know that. So they're able to help manage that a little bit, help manage that stress for people. The appointments are not quick and easy 10, 15-minute appointments. They're long. If you want a 10 or 15-minute appointment, you can have that. But they tend to be between half an hour and an hour long. So you really get that quality care with your provider or your health coach.
We use on-site, in-person health coaches, and it's at no cost to the employee. They can come in, see the health coach, typically for an 8-week period of time. And what's great is we as providers can work in conjunction with the health coaches, and it's a much more collaborative approach to improve that patient's health.
There's two buckets of people, right? You've got the folks who are utilizing their benefits and those that aren't. The ones that are utilizing their benefits, we can much better manage how they engage the existing health system. We can reduce a lot of the unnecessary care, the unnecessary referrals, labs, drugs, all of that. We can better manage it because we have a lot more time with those patients. It's convenient and they come. On the other side, you've got the folks who just don't go, right? And it doesn't mean that they're healthy necessarily. In fact, oftentimes it's the opposite. And so we have the opportunity to engage them in their health, help them understand what their condition is or isn't, get them engaged so that they may actually end up using a little bit more in the beginning, but what they're using are the inexpensive services, and you're avoiding things like an ER visit in the middle of the night or an urgent care visit in the middle of the night because they're walking around with conditions that they didn't know that they have. Ultimately, what we see is a significant shift in behavior, because it doesn't really matter what bucket they come from. They have the same experience in a Vera clinic, which is time with a provider and time with a health coach. And all of that results in some pretty significant shifts in the numbers. So within the first year, we see net savings of anywhere from 10 to 25%. And it presents itself in incredible ways. I mean, we've seen in particular cases, emergency room claims down 70%. We've seen urgent care claims down 60%, specialty care claims down 50%. The one bucket that sometimes goes up is actually is the preventive stuff, which is good. That means that all of those folks who currently weren't being seen and getting that necessary stuff taken care of, they now are, which is going to result in even more substantial long-term savings because of these train wrecks that we're heading off early. And that's the whole point of the model. It's to prevent that stuff, to help people change behavior, better manage the system, and everybody wins.